everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about predictable income, especially for new and young practices. I have had this question asked to me quite a few times about how can you predict or have reliable income coming into your practice every month. And it's kind of a complex question. It doesn't seem like it should be, but it really is. So I just thought we could do a very high-level basic video to start this conversation. I'm hoping that you will participate in the comments below if you are a new practice or you're an established practice and you have some ways of making sure that you're getting kind of like your baseline needs met when it comes to the financials every month and how you handle it. Obviously, a lot of this depends on your specialty and your patient volume, and also whether you are a new provider in the area or if you are a provider who has an established patient base that followed you from a previous practice. Again, this is a multifaceted, more complex situation than it might seem, and although you try to do your best to predict or anticipate how much money should be coming in a month, obviously you need to do that for budgeting reasons and stuff like that. It's not always a perfect science. And unfortunately, because of all of the different factors, depending on, what insurances majority of the patients have that you're seeing, if a lot of them have hit their deductible or not, and if the responsibility of payment is going to be on the patient or the insurance company plays a big deal into this. There's a lot of things that go in. And the one thing that I try to encourage, especially primary care, family practice, where this is a little bit easier, of course, is to try to schedule as many physicals or preventive exams as possible in a given day, and then a week, and then a month, right? Because preventive exams, things that are covered by insurance companies that don't go to patient deductibles, is going to be a little bit easier to anticipate because it should be paid quite quickly by insurance companies, assuming that you are completing your chart notes in a timely manner and submitting those clean claims. You should get payment pretty fast, and it doesn't usually go to patient responsibility because of the Affordable Care Act and all of the provisions on that. So if you can say, well, I need to see at least 4 preventive exams a day, which would be 20 a week for one provider if you're open 5 days a week, and that would be about 80 a month if you just say 4 weeks a month, then maybe that will help you. Again, with specialties, it's a little bit more difficult, but there are some preventive exams in different specialties that are covered. A lot of times patient benefits will cover an annual or biannual skin evaluation by dermatologists. There's different things out there, and hopefully depending on your specialty, you're aware of what those are to kind of adopt this idea. Again, it's one of those things that you need to know your specialty, you need to know your patient demographic, you need to know your patient volume, and then you can go from there. You can also look at your contracts and you can see kind of what your average reimbursement would probably be for different E&M visit code levels. So maybe for a 99203, because they're new patients, you anticipate $105 on average, if you took all of your contracts and you took all your reimbursement and found kind of the mean or the average of that reimbursement, that might be able to help you too. A lot of new patients are usually a level 3, I think. So, that could be good. It gives you room. If you do 204s, 205s, you get paid a little bit more. If you only bill out a 202, then you would get a little less, but it's kind of in the middle. And then depending on, of course, what volume of the different insurances that patients have. Medicaid is always going to be the lowest. So if you have a high volume of Medicaid patients, that's going to be more difficult. If you have more Medicare, it's still not very high, but it's higher than Medicaid. And then if you have a lot of commercial, then of course that's going to be better. With that being said, you also need to make sure that you're checking patient benefits and eligibility closely before they're seen, so that if patients are going to be responsible for a certain amount because of an unmet deductible or a coinsurance, you can have those ways to handle it established internally with your staff, and you can make sure that they're following through on it, whatever they need to do, they're communicating to patients as needed, and then you have a good patient collection process established as well. So as soon as those claims get processed, they go to patient responsibility, patient cost share, you have statements going out immediately, you have somebody monitoring how much is outstanding to patients, your front office is comfortable asking to collect on balances that patients have when they check in or they call over the phone. There's so many different things, but to try to anticipate and budget, you need to figure out kind of what your specialty is, how many you have to see of certain visits, stuff like that. So there's a lot that goes into it. And, physical therapy, depending on the insurance, you have maybe some patients who will have so many visits covered, and then after that it needs to go to a medical necessity review, so that might slow things down. So initially you might get the money, but if they come in more than a certain amount of times based on their eligibility and benefits, then you have to take more time and anticipate that and fill out the appropriate paperwork to send to the insurance. I mean, there's so many things that go into these different specialties, and insurances have made it more complex and difficult to navigate the space until you understand your specialty. Again, that it's not an easy, hard, and fast answer, unfortunately. But hopefully with the information I'm providing today, it helps you get to think about different ways you can try to anticipate the given amount that could be coming into your practice every month if you have set goals, and you share that with your registration front office for scheduling, saying, okay, we need to make sure we get at least this many of this type of appointment in a day, or this many with this insurance. Of course, you can't be discriminative. So you can't say, oh, we have too many Medicaid patients scheduled in one day, you can't schedule anymore. You can't do that. But you can say, okay, let's try to get, another preventive exam on a day that we have over 4 Medicaid patients scheduled. Or let's try to add an additional half an hour to the day, or ask the doctor if they want to try to squeeze in an additional appointment in a day without sacrificing patient safety, patient satisfaction, etc., to see if to overcompensate or compensate for seeing more Medicaid or something like that. You can get creative. Hopefully you have someone in your practice that is experienced, knowledgeable, that can help guide this process, and that will be able to help you kind of do trial and error. Maybe you'll try one situation and it didn't work out like you thought it would, so then you go to plan B and you try something else. It's not always as easy as just picking one thing and doing it. You might have to try a few different things to see what works best for you and your situation. But it is always important to have like that base minimum, that expectation of how much you need to bring in every month in order to pay your bills, your overhead, and then to be able to see how much extra you have a month to be able to try to anticipate maybe a future purchase of a big item, or to hire someone else new, or to be able to anticipate saving for deductible season next year. I mean, there's so many reasons why it's important to have this established and following through with, that it's not something that should be overlooked or be like, oh, that's too difficult, I don't want to deal with that. You do need to deal with it, but you just have to have someone helping you that has a lot of knowledge and background that can help troubleshoot, be creative, think outside the box. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with any of your colleagues whom you feel would help. Again, if you have any ideas or any ways that worked best for you in your specialty, in your situation, I would love to hear from you. Please share it with your colleagues in the comments section below. Thank you so much for the support. Take care of yourselves. We'll see you next time. Bye-bye.